and then I'm going to start recording. Guess it's automatically recording. Okay, welcome everybody. We're going to hang tight while we let people into the room, but welcome, and we'll get going shortly. Let's see. We'll give it just a couple of minutes. We're up to 94 attendees already, so we'll keep going. This is terrific. Hope everybody's staying safe and out of the smoke today. Okay, it looks like our numbers are kind of leveling off a little bit, and it's almost 3:05 now, so we'll go ahead and get going, and we'll go from there. So welcome. This is our pre-health orientation. This is our first time doing this as a webinar, and we realize that many of you are in Northern California, Southern California, sometimes not even in California, sometimes not even in the US, but here you are, and we're really glad that you're here with us. And so our agenda for today, kind of the way that things are going to roll out, is that we're going to have a welcome, which is now, and some brief introductions. And then we're going to do a short presentation about health careers, and then we're going to introduce the panelists more formally, and then give you plenty of time to ask questions of our amazing panelists that we're really fortunate to have with us today. So Brianna, take it away.
All right. So who we have with us today, we have Laura Burris, the professor and chair of biology. Oh, also there's me. I'm Brianna. I am the undergraduate coordinator specialist in biology.
Gosh, and somehow I didn't get your name on there. I'm so sorry.
That's okay. I guess I'm not that important in this conversation, but I'm here. We have Lauren Tenson, who's a medical student currently, and an SF State alum. Who we don't have with us, who might pop in later, Armand Kirikozin. He's a DPM. He's one of our faculty lecturers right now. We have Tomas Magana, MD, and Kalechi, who was okay, so you can correct me later. MPH, Dr. PH, and an alum of our postbac program. So that is who we have with us today.
Okay, so before we get started, I want to run a quick poll to see, and this is not the one that I wanted to run. Let's see if I can find the right one. Hang on. To see, here we go. Which career are you most interested in? That's correct. And so I'd like to ask that you guys fill out this poll so we know a little bit more about you and what kind of interest you have in health careers. So we've got 60 people responding so far, and this is great. This gives us a really nice idea of who's here and who's interested in different things. All right, so 10 more seconds for everybody to weigh in. Okay, so I'm going to end the poll, and then you can see kind of the results here. So the top answer, meaning that the most people are interested in being a physician, and that would be followed by nursing, physician's assistant, then dentistry and pharmacy, a little bit of optometry, and we didn't have any podiatrists today, but maybe if Armand shows up, then we'll get some converts to podiatry. So so there you go. Here's our results. Okay, so thank you for that. And back to Brianna.
Okay, So what we want you to do, just take about 15, 20 seconds to reflect on what got you interested in healthcare. And then once you take a few moments to reflect, please type your answer into our chat box. We as the panelists will be able to see your answers. Okay, so we're getting some good answers. Love for animals, like helping people, medical shows, we all watch those. Very compassionate, awesome.
So later on, we can ask Kalechi and Lawrence and Tomas how much being a healthcare professional is really like the medical shows. Maybe they can weigh in on that. And Lawrence, your face is very shadowy right now. I don't know if there's any way to get more light on you.
Yeah, let me try to fix that. Sorry about that.
No worries. Okay. And I think one of the reasons we asked this is because this is a very rewarding field, but it's not an easy field. And so I think it's always important to remember why you want to do this. And it's always important to have that in your heart so that you know as you look forward that, yes, this is why I want to do this. This is it. And to keep that with you at all times. All right. So thank you so much for those. I'll tell you, there's people here interested in all sorts of different careers. And so I don't want you to take notes right now, but what I will do is I'm going to drop the slides for today's presentation into the chat box. And hopefully I'll be able to send them to everyone. Hang on. And so that way you can open up it's not letting me put it in. Brianna, are you able to put in the slides? Because I wanted people to be able to open them and not have to write stuff down. We'll certainly send you the slides afterwards if we can't share them easily, but we would prefer to be able to give them to you now. And
yeah, I think we'll have to do it after.
Okay. And so what I want to tell you though is there's a lot of different resources online, and these are just some of them. So don't worry about writing them down. They'll be there. And that each profession, medical profession, has an association of the schools and colleges of that profession. And so you can Google those and find them. And each of those links, once you get in there, will have stuff about what are the prerequisites, what is it like to have a career in this field, how do I apply, and all of that sort of thing. So these are incredibly helpful links. I will tell you also that all this stuff over on the side doesn't really relate exactly to the slide. Some of these are good habits of mind to have as a scientist, and some of them reflect the values of San Francisco State. So don't try to link these up to what's on the content on the slides. And so here's our next piece.
All right, so this is what we'll be going over basically for the rest of the presentation. So how do you prepare for professional school? I won't go over all of these right now because we'll get into all of them, but a few things we'll talk about is how do I decide which courses to take? How do you get good letters of recommendation? How do you get real-world clinical research experience? How do you apply? So Laura and I will be going into more details over these things in our next few slides.
Okay, thank you for that. And so this slide is kind of crazy. This slide shows some of the typical science course requirements for different health professions. There is no single set of courses that will work for every school in the health profession that you want to do. And so the way I did this was these are some of the courses at San Francisco State and their titles. And I've mapped this out by different healthcare careers. And so the red dot indicates that it's required by many schools. It doesn't mean all schools. The blue dot means that it's often recommended. But what I would encourage you to do, regardless of what field you're in, is to look at a number of schools, look at their prerequisites, and make your own spreadsheet so that you know exactly which classes you'll need to take in order to apply for those sets of schools. So please don't take this as the holy gospel. It's really dependent on which schools you apply to. But once you have your own spreadsheet, then you can help, you can navigate your way through the courses. And so many of them, I'll say, kind of common features is that you usually need a year of introductory biology. There's often some chemistry, depending on the field, maybe some OChem. There's usually some math and some physics. But this will all be dependent on each school that you want to apply to. Brianna?
Okay. So how do you decide which courses to take? So you'll want to look online for all the schools that you're interested to find out exactly what prerequisite courses are needed for your particular path. This is going to require research on your end. Not all schools are the same, so you'll definitely want to do the research on your side. And then you can meet with your major advisor and share with them your career path, and they'll help you to create a roadmap to graduation. But yeah, make sure you do your own research. Don't just rely on your major advisor, because this kind of depends on you. Our major advisors are totally here to help you out, and they're really awesome. But you'll definitely have to do some research on your side to figure out exactly what you want to do and what that looks like when it comes to all of your prereqs.
Thank you. And so one thing that I'm sure you've heard about that's pretty important for applying to any sort of health professional school is your GPA, that grade point average. And so what I want to say is, yes, it's important. There's no doubt about it. I'm not even going to put numbers out there because I don't believe in them. One thing that's super important is don't be defined by your GPA. I've seen students who had, I advised a student once who had a GPA of 1.0, but had a very challenging set of circumstances. And I said, hey, draw a line in the sand. Let's fix what's going on. And we did. We got some solutions in what was going on in that student's life. Said, there's your line in the sand. Let's start over. And that student did it, and they went on and got offers at, I think, 5 or 6 major medical schools. So don't be defined by your GPA, but you want to take care of it when you can. And so when you plan your course schedule, make sure that you consider the workload that's going to allow you to be successful. It's kind of like your baby. You want to take good care of your baby, and you don't want to let it not get fed and get sick. You got to take good care of it all the time. And it's much easier to stay on top of it than it is to repair it if it goes down the tubes. And so if you have a job or some caretaking responsibilities that require some time, then consider slowing down, taking fewer units. Maybe it'll take 5 or 6 years to graduate, maybe 7, maybe 8. That's okay. It's much easier and saner to do this at a rate that allows you to get to your goal than to damage your GPA and try to get it back. It's much harder. And so in general, we recommend no more than 6 to 9 units of STEM subjects per semester. Don't do all your GEs first and then load up on your STEM courses later and take 15 units a semester. That's just too much, and it's a really heavy course load. So try to spread it out over the entire time that you're at the university, and then I think you'll get to a successful place. But don't be afraid to slow down.
Okay, so how can you get good letters of recommendation? So your letters of rec are hugely important when you are applying. So now is the time to cultivate relationships with whoever is going to be writing your letters. So a few things to keep in mind is asking a lot of questions in class, actively participating in classroom discussions, being curious, demonstrating commitment to learning, coming to office hours. That's super important to build a relationship with professors. And of course, being a team player.
Oops, thank you for that. And so The next kind of thing that you'll need for your application is a personal statement. And what I can tell you, I've met some of you, I haven't met you all, but I know that each of you has a story to tell. And so I always advise people, you know, you want to show off your good qualities and your attributes, but each of you has a story. And so be as personal as you can. You know, people on admissions committees are going to read hundreds and hundreds of applications. And so if they feel like they get to know you, then it's really going to stick in their minds. And so what qualities do you bring to the table? And give specific examples of things you've done that have exhibited those qualities. What obstacles have you overcome? Give some specific examples. Are you first generation college going? Did you come from a family without many economic resources? What have you had to overcome? And what's your motivation for being a healthcare provider? So you need to bring your whole self to the table in these statements to be seen.
Okay. So how can you get real world clinical or research experience? So these are a lot of resources already, and then there's tons of more resources out there. So the examples we have are for clinics, medical centers and hospitals, volunteer centers, volunteer programs abroad. So I won't go over all of these. We'll definitely be sending these out to you. But yeah, there's a lot of research experience out there that you can get if you just do a little research on your own. But these ones are also great that we provided for you.
Okay. And so then there's the dreaded question of which standardized test should I take? So many medical schools and colleges, health professional colleges, are moving away from standardized tests, thank goodness, because I personally think they're awful and not a very good gauge of how you will do as a health professional. But many still do require these tests. And so here's just a list of some of the most common tests that are required. But again, look at the schools you want to apply to and make sure that you understand what they're requiring when you apply.
And how do you apply? Most of the pathways have their own centralized application process and timeline. So again, when you do your research for the career path you want and the schools you're looking into, definitely research their application process. All this information is online. So definitely just look at your school site that you're interested in and see what they're asking for you for application-wise.
Okay, and so we just kind of bombarded you with a ton of information, which we will share the PowerPoint. So during all of this, through your undergraduate career and your professional career, you're going to want to find ways to stay resilient. This is really critical. Being a medical professional can be very demanding, can be very draining. And so you have to find ways to take care of yourself, whether it's connecting with family, friends, community, and then college environment, it can be having study groups, but you've got to find ways to stay connected with others and to stay kind of true to yourself. Some people use meditation and other types of self-care. Are you getting exercise? Are you eating right? Are you sleeping enough? I sound like your mother now, but these are all really super important as you consider and pursue a career in health professions.
So top tips for success from our biology student leaders. These are actually from our peer mentors from our program in biology. So number one, find a good advisor. Yeah, that's one of the most important steps. And all of our advisors are great, and they'll help you get on the right path and make sure that you get to your goals here in biology. Make friends in your classes and create lots of study groups. Don't be afraid to ask for help or resources if or when you need them, and talk to as many people as you can. We have great faculty members and resources available to students. Even though we aren't physically on campus now, a lot of these resources are available online. So we still have all of those great things. And so we have a lot of resources for educational, professional, financial and health-related needs. So if you need those things, please find them. They're really all online, so they can still help you. Don't be shy. Reach out if you need or want something. You never know that one interaction may change your life. Participate in Zoom breakout rooms during class. This goes along well with our second tip. That's how you can make friends in your classes and create study groups as well. Don't doubt yourself, because you can definitely do it. Plan out your classes for every semester. Don't wait or try to figure out as you go. This will be a good thing if you want to meet with an advisor and kind of go over your plans for each semester. Try to be comfortable with the fact that failure is a normal thing and you can bounce back from it. Do not give up. Try your best to not lose sight of your end goal. People have said that the first 2 years can be especially daunting, difficult, but don't forget, while you're pursuing a higher degree, why you want to be in healthcare. Don't forget about that. And 10, it's a little cut off, but I have it here. Biology is beautiful. Grades are important. Lab work is important, but don't get so lost in grades and lab assignments that you forget to stop and enjoy the beauty of biology. So don't get caught up in the grades. So yeah, don't get caught up in the grades. Obviously grades are important, but there's a lot of more other important things along the way.
Okay, thank you, Brianna. And so quickly, I just want to mention a couple of other resources that you might find interesting. And I see that Armand has joined us now, Dr. Kirkosian. And so next spring, he's going to be teaching an Introduction to Health Professions course called Sci 239. And this will be a great chance to learn more about various health professions. And also SF Build is a tremendous grant-funded program that has SF Build Scholars, which are students from underrepresented backgrounds who participate in clinical research and health disparities. And so this is a great place to explore as well. And Kelechi might be able to add more about that in a little bit. And so with no further ado, I'd like to have our panelists each introduce themselves by name, probably in the order as shown on the slide, and say just a little bit about who you are, you know, what your path was, anything, just a few sentences about your path and what you do now, so that students will get to know you. And then I'll ask you another follow-up question. So Tomas, will you start us off?
Thank you, Laura. I'd be glad to. Can you hear me?
Mm-hmm.
Okay. Hello, everybody, and I'm delighted to be on this panel. I really appreciate this. I always appreciate any opportunity to support and inform future healthcare professionals. I am a physician. I am a pediatrician and adolescent medicine doctor in particular, which means I care for the population between 11 and 24 years old, which is kind of a subspecialization within the field of pediatrics. I work in a federally qualified health center in the East Bay called La Clínica de la Raza, which serves primarily a large Latino population, large immigrant, and primarily underserved. I went to medical school at UCSF and did my residency at Benioff Children's Hospital in Oakland. And I think most importantly, in terms of talking about journey, and I think this may be true for many of you, I am a first-gen college student, which means I am the first in my family to graduate from college, and certainly the first to and only, frankly, to move on to a professional program. So like many of you, I imagine I had to pretty much navigate this journey by myself with very little mentorship and very little support. And so as a result, I learned a lot of lessons. So a big part of my career is mentorship of future health professional students. I work with my partner, Kelechi, who will tell you a little bit more about our journey together and the work that we do with college students, but I also run a national youth pipeline program to get young people into the health professions to really increase our diversity and to make sure that we have people reflective of all of our demographics in the field of medicine. So I'll leave it at that because I'm sure a lot more information will come from our questions. And I have a lot to say, but I want to make sure that everybody gets a chance. So I'll leave it there for now.
Thank you, Tomas. Kalechi.
You're welcome.
All right. First, I want to say congratulations to everyone on the line for just showing up, right? There's a lot going on in the world with the pandemic and just family and life and social injustices. And I know that there are a million and one things that you need to be doing. So just, kudos to you. Pat yourself on the back for just showing up today and taking this step to just learn more information about the journey and where you're headed. And I'm really excited for you all and happy to help in any way possible. So I'll just start with that. And my name is Kalechi Wezoke. I have my master's in public health and I have a doctorate in public health. I did my undergrad at UC Berkeley, as well as my doctorate at UC Berkeley and my postbac actually at San Francisco State. My dissertation work research focused on studying the pre-med experiences of underrepresented minority students in the UC system. So I have been doing this work for quite a long time to better understand just the challenges and the barriers that people face. Similar to Tomas, same in terms of first in my family to go on to college here. I was born in Nigeria, but grew up in Los Angeles, Inglewood, California, where I heard it was like 1,001 degrees the other day. So for those of you that are in SoCal, apologies to you. And so I have been doing this work for a long time. I actually met Tomas, Dr. Magana, when he's known me half my life. So I met him when I was an undergrad at Cal, and he was my mentor because I was pre-med at the time. So I'm happy to talk to all those of you who are on the line that are pre-med as well. I'm sure as future Dr. Lawrence can be of assistance. But I say that to say you never know where you're going to end up. So he's gone from my mentor to being a lifelong friend and now colleague. And so we're full circle working together now. And so a lot of the work that I do is with SF Build. I'm the Assistant Director for Diversity, Inclusion, and Community Partnerships. And as Laura mentioned, the bulk of our work is really just working with students who are considered underrepresented in the field to help increase the diversity of the biomedical workforce. We focus on understanding that students need to be viewed through the lens of an asset-based model rather than a deficit model. You come with so many strengths that maybe sometimes are not really highlighted in your journey through education and higher ed. So we want to make sure that we do that here for you. So I have a wealth of information for anyone that might be interested in public health, either the master's or the doctorate in pre-med or any other types of health fields. We have a couple of our programs that do involve undergraduate research opportunities. And so I saw some of those in the chat box. And so I'm happy to talk more about that for both our STEM students who are interested in research and pre-med students through our Aspiring Physicians program that's in collaboration with UCSF Medical School. So yeah, this is my life's work. I love helping students. I love helping people figure out, discover, embrace their journey and just, do everything that they need to do to make sure that their goals happen. So I'll stop there and pass it on to the next person. I think Dr.
Okay, Armand, bring it on.
Hi, everybody. My name is Armand Kirakosian, and I've been with San Francisco State since 2006. I've been initially started teaching the anatomy lab there, and took over the lecture portion this past 3 years or so. I'm a foot and ankle surgeon. I did my residency training from 2007 to 2010 at the Department of Veterans Affairs in San Francisco. I'm currently the residency director at the Veterans Administration. We have 6 residents there. We do have students rotating through our facility once a month, different students coming in, medical students, podiatry students, any students that we can get our hands on, they have a rotation. I have taken my anatomy students to our surgical field into our operating room in the past. And, since the COVID hit, the hospitals were reluctant to take anybody in as far as like students go, but they are going to reopen again. And, we'll definitely have interest if anybody wants to come in and observe surgeries and see what we do and what the field is about. It's more than welcome to do that. I just email me, we'll set up a date, we'll set up a time frame, and we can go from there. I enjoy my time teaching at State because the students there are very eager to learn, and they go through a good educational process. And applying to medical school is a challenge as itself goes, going through that and through MCATs and whatnot. But I recently got involved with this summer for advisement, and there was a lot of people reaching out and asking what should they do, how should they apply to medical schools, when should they take the MCAT scores. It's a big challenge. I remember I myself going through that, and honestly, I had no help. I wish I had enough information to do the same, but we're here for you guys. Any questions you guys have, more than welcome to answer it.
Okay, thank you, Armand. And last but not least is Lawrence Henson, who is a San Francisco State alum. He's like the closest to you guys, like you could be him in just a couple of years. So Lawrence, welcome.
Thank you, Laura. Really honored to be here and nice to meet you all. I am Lawrence Henson. I am currently a fourth-year medical student at the University of California, San Francisco. And a bit about myself, I grew up in the Philippines. I immigrated here back in 2010 because I really wanted to be a doctor. I was deferred to graduate college and ever go to professional school. And I grew up in a farm. I grew up in a rural area where there was no access to doctors. And so I really, really wanted to be a doctor, but I couldn't do it in the Philippines. And so I did the boneheaded idea of going by myself, immigrating to the United States and applying into San Francisco State University. And I majored in physiology. And now here I am. I am about to finish my medical school and I'm applying into anesthesiology. So I am very invested in pre-health education. I believe that we need more diversity in terms of the people that we work with because our patient populations are also becoming more and more diverse every year. And so I've worked very closely with students with pre-health, not just pre-medical, but also pre-dental, pre-pharmacy, and pre-physical therapy students at the Stanford Center of Excellence with Marcel Anthony. I am also very passionate about global health and public health, in that I finished a Master's of Public Health at Berkeley a year ago, and I conducted a research on understanding the disparities existing in San Francisco Bay Area, especially for immigrant populations who are experiencing gentrification, and I'm also very passionate about disability. So please, at any point, I'm happy to share my email if you have any questions about the process of getting into or applying into any professional school. Happy to help, starting a research or starting to think of like a thesis statement. Always happy to give my 2 cents.
Okay, thank you, Lawrence. So I'm gonna start off the questions and then I'll go into the ones in the Q&A. But my first question for the panel, and what is one thing you know now that you wished you had known when you were an undergraduate in terms of kind of pursuing your career here? And I'll let you pipe up in any order that seems fitting.
Well, one thing for me is that I wish I wish I knew what the majors actually meant. I majored in hospitality back in the Philippines, and because it had the word hospital in it, I thought it was a pathway to getting into medicine. And 2 years later, they told me I can't get into medicine with that major in hospitality. That's what prompted me immigrating in the first place.
That's a great story.
To answer the question more seriously, I think one thing I would hope was that if I knew which courses were very important for medical school or which would contribute the most to medical school, I would have taken those courses more, or I would have taken more iterations of those courses. Specifically, anatomy and physiology are very important in medical school, in my opinion. I would have taken those much more frequently and would have paid extra attention and taken more detailed notes, because those two were very, very helpful.
Thank you, Lawrence.
I'd like to kind of follow up on that comment, and it relates to majors, and I think this is important for all pre-health students to know. It is not mandatory nor necessary for somebody to major in science to enter the School of Medicine or any other pre-health program. College is a time frankly, we're probably the only time in your life when you are going to be able to study an array of whatever those subjects are that fascinate you. And it is therefore important that you choose a major that is most in alignment with your interests and your passions. Because if the classes appeal to you and talk to you in a way that meets your interests, you are much more likely to do well in those academically. And I have seen too many pre-health students try to adapt themselves to a chemistry major or a hard science major, thinking that that is going to optimize their success and entry into medical school. And in the process, because it is not a major that they really align with, or they do poor planning, and Laura, as you suggested, they load themselves up with far too many STEM classes at one time, their GPAs pay the price and their academics, and then you have to do a lot of backtracking and remediation to try to get that up to make yourself competitive. As opposed to the student who chooses a major, whatever that may be, linguistics, literature, right, history, philosophy, that you do well in, and then meet the prerequisites for the particular schools that you have, and make sure you separate those over your undergraduate career course so that you are not too loaded, that you will optimize your success in that, right? Science is not a mandatory major to get into, nor will it make you more eligible. My best friend in medical school was an anthropology major, and he did his prerequisites, frankly, after he graduated from college. So I just want that to be very, very clear with regard to that, because I think that's a misunderstanding.
Thank you, Tomas.
Yeah, I will wholeheartedly agree with that. I see and have advised so many students who unfortunately sort of take their first step onto a campus, and the first person they come across, they mention that they're interested in a health career or medicine, and then the person tells them, oh, well, then just major in biology or just major in, this sciences course, without really having a conversation about what it is they're actually interested in, what, they're passionate about, what brings them joy, what brings them excitement in terms of just learning, right? And so I definitely want to echo that sentiment of finding a major that you care about, that you are interested in, and that you will thrive in. And so I also recommend to kind of consider what skill set you also want to have once you leave undergrad. I mean, I know we tend to think of the next step as what career I want to have, but think of what skills you actually want to leave undergrad having, and then consider what majors you may want to, tap into as you are doing that. I would also say the second thing is also just understanding that there's going to be a transition about the way that you study and how you studied in high school, and how there may need to be a shift in how you studied in high school and what was successful for you then, and how that translates to undergrad and what will be successful for you. And that was one of the major even things that I noticed personally, but also one of the findings from my research was that so many students realized probably far too late into their undergraduate career that they didn't know how to study for undergrad. So many of them said, I couldn't just memorize the way that I did in high school and get straight A's. It just didn't work. And so I think just taking the time to actually stop and kind of try to dissect how you studied in high school, how you're studying presently, and whether or not that is working for you. And if it is not working for you, taking some time to figure out, okay, what is going to be the best course of action so that I can actually learn how to study for these classes in particular, and then engaging in that work so that you can see the rewards from it.
Thank you. Armand, do you have any advice that you wish you had known when you were an undergraduate? You might have had to step off for a minute. So I'm looking at the Q&A channel here, and there's lots of questions coming in, so thank you for that. And I'll try to kind of synthesize them into some kind of more global questions. And so one of the questions that I'll put out to the panel is, right now with COVID, students have a lot of questions about how to get volunteer experience since they're not really allowed to be doing a lot of things. And so do you have any best suggestions for kind of finding internships in principle, but especially during COVID?
So I'll comment a little bit upon that. You know, I think the notion of experience is a complicated one and has to be interpreted in different ways. I think traditionally many pre-health students think that the best way to get any type of experience is through volunteers, you know, volunteering at a clinician or a hospital or something to that effect. And the truth is that in many ways, those experiences are quite limited, both in terms of the quality and the scope of what you're going to be doing. It really don't offer much insight in what it is to actually be in that field. It's really more kind of a resume check off. And honestly, that's not going to give you a better indication of what the challenges are that are affecting community in the areas of health. So I think it's, you know, we want to expand on what it is that, what's the whole purpose of volunteer and clinical these experiences. The whole purpose is for you guys to get insight into what the practice of that particular field involves, and really what are the issues facing our community as they are related to health and health disparities. And there's many ways that that type of experience can be obtained that aren't necessarily through a health agency. Many nonprofit agencies are serving communities that are dealing with very significant health issues. And let's think health broadly. Health is related to any kind of social determinant that impacts well-being. It could be related to homelessness. It could be related to drug abuse. It could be related to domestic violence, right? It could be related to suicidality, hotlines, stuff like that. All of those relate to this context of how our communities are dealing with health issues. And so the goal is ultimately that whatever it is you choose to participate in or volunteer in, number one, it's meaningful to you. Because if it's meaningful to you, then you're going to get much more out of it, and it's going to resonate with your heart and your passion. The second piece of it is that if you're going to be including that experience in your statement or in your interview, and I ask you to tell me what that experience taught you and how it informed you, what I want to hear is not specifically what you did, but rather what you learned from it. How did you grow from it? How did it inform your awareness of what issues are in fact impacting our community? Right? What are some solutions that you have seen through this experience that will address certain health disparities or issues that our communities are facing? So I'm not looking for a list of, you know, skill sets, you know, clinical skill sets. I'm looking for growth and development and awareness and evolution. So if you can identify those type of experiences, which are not dependent upon trying to find those competitive internship experiences, you'll frankly be much more richer. So I'll stop there because I think others may have some thoughts about that, or I'll take other clarifying questions on that.
Yeah. Any other panelists want to weigh in on that?
I'd just like to echo Dr. Magana's statement on how it's best to focus on how these experiences will benefit you and make you understand a good idea of what, for example, a doctor does in these kinds of situations. And to kind of echo my own experiences, shadowing has been valuable. I've learned a great deal from shadowing, but the experiences that really given me a lot of insight into why I wanted to become a physician were the ones where I was participating in the care of a patient. Those ones, unfortunately, are difficult, I understand, because of COVID times. And so I encourage you to explore avenues like communities that are in need of help from volunteering. I think at this point, we really need a lot of like specifically for just thinking the available opportunities at UCSF. Our homeless clinic is in real need of a lot of volunteers at the moment because we are very short-staffed. And so I'll get back and I'll send a link to any opportunities that I find, because I know we are a lot of short-staffed in a lot of the clinics, a lot of the free clinics at UCSF.
Great. Thank you. Anybody else? So there's also a few questions about letters of recommendation, like who needs to write them? Is it better that it's from a STEM professor or any professor, or what? How do you cultivate those relationships, and who will the strong letters be from?
That's the eternal question. I guess I'll start that off. I think, you know, for some schools, again, you have to be aware of what some schools require. There are some schools that actually require maybe one letter from a science or STEM teacher who can comment on your abilities from that. Often the other letters are left up to whoever you feel knows you the most. What I will tell you, what is not effective, and I don't care how prestigious a recommender is or how many degrees they have behind their name, if that letter is so, does not have any detail or any insight into you as a person or as a student, it really isn't going to offer you much value. So therefore, it is important when you think about who it is that you want to write a letter, you really want to choose somebody who has some insight into who you are, both as a person and or as a student, and really has understood to some extent your journey and your abilities, right, to succeed completely, to succeed successfully in an academic environment. That may be a professor, that may be a mentor, that may be an employer, it may be a supervisor from some volunteer work that you did. I think, you know, the most important thing is that it is somebody who you have nurtured and fostered a relationship with over time. And the other piece of it too is, and Laura, I can't, you know, I'm really glad that you suggested this. One of the worst ways of asking a letter is by asking a professor who had you 3 years ago, who has really no memory of you, and because you're desperate for a STEM professor, you're asking them, you know, to now comment on you and write something for you at the most important time of your life. You want to be sure that if you're going to be asking somebody for it, you've really, really made some effort to keep that person informed around your progress and your journey, right? And sometimes that's hard for students. You don't want to bother people. You realize that they're busy. But I have had students ask me early on, you know, I would hope that you would consider writing me a letter, you know, in the future. I've really enjoyed working with you. I've really enjoyed this experience. This is something what I do. Would you feel comfortable doing that? And I'll be honest, if I feel that I can, you know, adequately reflect on them as a human being and as a person, then I will agree to do so. But if I've only had very little interaction with that student, it's really not worth it, honestly. So start the process early, being thoughtful, and please, this kind of relates to one of the things of advice, Laura, that you offered. One of the things I would have done much more frequently as an undergraduate is I would have asked for help much more frequently than what I did. And I think that's a very, very common problem, particularly with first generation students, is that we all, and I don't mean to generalize or stereotype in any way, I guess I'll talk from my own personal experience. We often have had to kind of navigate these journeys by ourselves, and we figure we can figure it out because we're resilient and resourceful in that way. But it also can work against us in the fact that we don't want to bother folks. We certainly don't want to ask for help because it may run against the grain, and that is not going to do you a service in any way. So please, please, please reach out and start your planning early. Hope that's helpful.
Yeah. Any other thoughts about letters of recommendation, Kalechi?
Yeah, I would agree. As one who has been approached frequently to write letters for students applying to medical school and graduate school, I think one of the first pieces of advice is that I recommend that even in your request or ask for the letter, your words matter. So not just asking if someone can write you a letter of rec, but asking whether or not they feel that they can write you a superb, a strong letter of recommendation. Because if they give pause when you ask in that way, then you may want to sort of also have pause about whether or not this is someone that you want speaking on your behalf. Because I think the only thing quite frankly, letters can be, not totally, but I've seen some letters that can make or break students, and it's really unfortunate, right? And so I think the way that you approach people to ask is important, and it matters. With that, then I also often recommend that students, to Tomas's point and Laura's point, do not wait until you are applying to try to retroactively go and find someone to write you a letter. This is one of the biggest issues that I have from students, because they approach me all the time and they feel that they don't have anyone that they can ask because it's been so many years. And so for those of you, wherever you are, if you know that at some point you're going to need a letter of recommendation, I strongly recommend that you stay in contact with your professors, that you keep them just abreast and up to date with what's going on with you. And then sooner rather than later, you actually ask them to write a letter. It's better for them to have a letter that they just have to edit and tweak maybe a year or 2 or 3 down the line than to wait 4 years and have them try to then retroactively remember. So it's better to get the letter now and then just have them be able to edit, and you stay in contact with them over the course of the years. And I have, you know, additional tips for easy ways to keep in contact with people, because that's another question that often comes up.
So I have a corollary question for you all, because I see this quite a bit. If somebody's taken a course, if they have a choice between somebody who is maybe a graduate teaching assistant and a faculty member, do you have any preference in who writes that letter?
You want to ask the person who's going to be most reflective of you and your experiences and your abilities. What will often happen sometimes, and this can be a possibility, is that the graduate student may actually compose the letter, but the professor can potentially sign it, right, if that's an issue. There are many, many times where letters are co-written in that way. For instance, if you're in a program and you don't work necessarily with the director of the program, who has perhaps more of a reputation, but you work with one of the program associates or something, often the program associate can compose and write the narrative, most of that letter, and then the program director can be asked to sign that, right? And maybe even add some additional insight into that. But the primary narrative needs to be from that person who knows you the best. And if it's a graduate student and ultimately the graduate student is the one who signs it, so be it, because it's the quality of the narrative itself and not so much who actually wrote it.
Okay. So there's also some questions out about kind of research experiences, and are those useful, and what would you have to say about a student wanting to get involved in research, and then how can they do that? And I can actually pipe in a little bit on the how, but tell me what's your take on research experience as opposed to clinical experience?
I think research is a vital part of any pre-health career, but at the same time, I could say that clinical experiences speak a lot more to how you will be as a future physician, future physical therapist, or future pharmacist, much more strongly than research experiences. So, but that's my subjective opinion of it. What I would recommend is to try to get experiences, specifically research experiences, is if you've had specifically a STEM class with a professor, and say, for instance, in a lab, you've had experience working closely with the research assistant or the TA, you can talk to them about your interest in a specific topic. You can I would highly recommend reading up what the research, what the TA or the professor's research area of interest is, and read up a little bit about what they publish and see what about it strikes you as interesting. And if you find it to be really, really interesting and really relevant to what you want to do, then I would recommend scheduling some time to talk about it, like see if it's a good fit for you. And in terms of weighing research versus clinical experience, I'm a little bit torn on that, because I do value research as much as I value clinical experience. But I would say that in terms of speaking from my experience, trying to get into medical school, I would value clinical experience more than research experience.
Anybody else?
Yeah, you know, look, I'm going to always return to the notion of the quality of the experience, ultimately. If research is something that you are interested in and you want to pursue it because you are genuinely interested in learning more about what research entails and how it is implemented, then by all means seek out that opportunity to do that. Because again, then when you talk about it, you're going to talk about it with some knowledge and some passion about it. And from the perspective of research, you know, I think many people traditionally kind of go to this notion of research being in kind of in a laboratory, working at a wet lab or whatever that may be. But you have to remember that research is broad. There's public health research, there's social science research, there's behavioral health research, there's community-based participatory research. There's many ways in which research is done. So if you can align yourself with a project or a topic that really interests you, by all means do it. What we certainly don't want is the student or the applicant who just kind of does it for the lack of just getting some volunteer experience washing, flasks, and then that qualifies as their research experience because they participated in a few group meetings and now can say that they can check that box off. I mean, frankly, I think that's not necessarily a great use of one's time. Because again, if you can devote that time to a volunteer project or something that has some meat in it, or where you develop some leadership skill in it, and really can talk about the impact of that particular project, I think that's going to be much more impactful in supporting your application to a professional school.
And so I agree with all of that. And I'll pipe in that at least in biology, and I know not everybody here is a biologist, but at least in biology, you know, there's a lot of research opportunities if that's the thing that interests you and you're passionate about. And the way to get engaged in research is to simply go to the website, look at the research of different faculty members, and I assume this is similar in other departments, and shoot them an email. Say, hey, I'm so-and-so, I'm, interested in pursuing a career in blank, and I was reading about your research and it's really interesting. In fact, I got some questions because people love it when you're curious. And say, would you have a time to chat with me about the possibility of joining your lab? And it does take some persistence. Faculty get a lot of emails, and even the best intentioned faculty, some emails drop through the cracks or they don't know the answer that day, so they kind of put it off and wait 7 days, and then it's 1,000 messages down on their email. But just keep trying until you get a reply, and know that not everybody will have space, but it's a possibility if that's the thing that interests you the most.
Laura, another resource students should be aware of too is that there are actually formal student participatory research programs that are funded, by agencies at different universities that can actually assign you to work, in a summer project with a principal investigator and actually could provide a stipend in research. So I would encourage students to do their homework. Look at those various programs for college students in terms of research. I know that Children's Hospital Research Institute over in Oakland has a summer program.
Yeah.
There's a lot of programs, particularly for students who identify as underrepresented minority, as a way of diversifying that. And so those can be quite valuable. Now, again, they can be quite competitive as well. So you don't want to wait to the last minute to apply to it. You want to do your homework, make sure that you get the letters of recommendation for it, that you think about your statement, and also really think about, why this particular program appeals to you. So again, it requires you to do your homework.
Thank you. And so I'm going to follow up on this vein, and then I'll come back to the MCATs and standardized tests, because a lot of people are asking questions about that. But on this vein, can one of the panelists explain the difference between an MD and a PhD, and how should people think about which degree they might want to have? I'm gonna call on Kalechi.
Exactly.
I had a feeling. So even though there are MDs here and current MDs workings in the room, I was initially pre-med and sort of navigated off to the doctorate route. I think similar to the conversation that we were actually just having about research, right? How there's a clinical research and then the other type of quote unquote STEM research or lab research. When I think MD, I think of the practice of medicine, right? The clinical side of medicine, the working with patients, either on an individual basis or on a group basis. And so obviously there's a different pathway that you take for medicine. You know, you go on to medical school, which is typically 4 years, and then followed by whatever, a certain number of years of residency based on the field or the interest that you want to go in and focus on, which can range anywhere from 3 to, I think, 7 to 10 years with some super subspecialties. And then with the PhD, that's typically the sort of the research route for people who are interested oftentimes in going into academia and doing research, and so being professors or being faculty members. And so honestly, everything has caveats though, right? Because you can actually get your MD and you can still teach and be a professor or a faculty member if you so desired. If you went the PhD route, you would not be able to practice medicine though, for obvious reasons. And I do recognize that someone also mentioned the MD PhD route. And so that is for some people who are academic scientists. And so some of them, they want to actually practice medicine, but then they also want to do research as well, and also want to engage in faculty work. And so I think if you really stop and consider, okay, what do I really envision myself doing? Is it more so the hands-on practical clinical experience of working with patients hands-on, or is it more so the idea of engaging in an academic type of career where I engage in research work that might be really relevant to medicine and healthcare and health disparities, or teaching the future physicians? Then that's sort of kind of how I sort of separate the two out. So again, it's not always as linear, but I think safe to say that if you want to work with patients, treat patients, and we're just talking about MD, PhD here, there are many other clinical careers that you can do in terms of nursing and PA. But if you want to have the actual practice of medicine and seeing patients, then you will need the MD to do that versus the PhD.
And I think I'll weigh in a little bit too, as somebody who applied to both PhD programs and medical programs many years ago. I was one of those students who I just wasn't sure what I wanted to do. And so I applied to both. I got into both. I went to interviews for both. I got into both. But it was really, for me, the process of exploration that made it clear which route I was going to do. I kind of have to, it's like buying clothes. I have to try them on to know. And so by applying to both and going to those interviews, I had a pretty good idea. Did I make the right decision? I'm really happy with my job. Do I sometimes think about, gosh, what would have been like to be a physician? Yeah, sometimes I do. And I'll point out that for some of you, those of you who really like being in school, there's a third option, which is the MD PhD, that the two can be combined. And I think it makes for a very unique combination to have somebody trained in both clinical science and research science. And so that's a very interesting possibility.
You know, I should add that, you know, my wife is a research scientist and a professor of biology at San Francisco State. She has absolutely no interest in clinical medicine, unlike me. And this is a very simplified version of how we say it, but frankly, you know, the way I perceive it is that it is the researchers and the PhDs who really do the investigation and apply the science to solving problems and proposing solutions and answers. And physicians in some way, you know, we take then that incredible amount of knowledge and science which has been done and then actually apply it, implement to the practice of medicine. Now that's a very simplified version of that, of the notion of that. But there are ways, just as Laura and Kelechi have said, where you can absolutely do both. Absolutely do both. You don't necessarily have to choose one or the other.
Anything else? Has Armand jumped back on yet? I think he's still, something must have come up. So another question there's a lot of is these darn standardized tests. So when do you take them? How do you study for them? How do you get through it? All of those things. What's your best advice on that? I'm going to start with Lawrence this time because he's the closest to having taken one of those darn standardized tests.
So yes, so the standardized tests, GREs, the MCATs, DMATs. So timing-wise, you would like to take them approximately about a year before you want to get in. That's like I suppose the minimum amount of time you would like. So if you want to matriculate to medical school, for example, in June of 2022, let's say you wanted to matriculate in June of 2022, you would maybe the last date you would like to take your scores would be the December of 2021. That's the latest you could take it. I would recommend taking it a little bit before that to give you some time to retake it if you don't get the score that you would like for the program that you would like to apply to. So it's always going to be at least a minimum of 6 months before you want to get in. So if you want to get in June 2022, last day you would ideally want to take it is December of 2021. You want to get in 2023, last day is December 2022. So the reason I say that you don't want to push it as close as possible to your admission date is because sometimes you might not get the score that you want. For me, I didn't get the score that would help me get into medical school the first time. I totally bombed my first MCAT. I had to retake it. And so in terms of preparation for it, this is where getting a good understanding of your foundations and your prerequisite courses is key, because for the MCAT, what's really required to succeed in the MCAT is having a really firm understanding of your basic biology, your chemistry, organic chemistry and physics, and now social sciences and psychology. So getting a good grasp of that takes a different kind of rewiring to your brain. For me, what I had to do was I had to use this software called Anki, where I had flashcards. I created my own flashcards and essentially did spaced repetition of learning materials over a period of 2 months, wherein I would go through 100 to 200 flashcards every day, do it every day, but make sure that I don't burn out. So that's a more detailed talk, but I would recommend studying consistently throughout your undergraduate career. Like, I feel like getting a strong foundation by really diligently studying and understanding your courses, your STEM classes, is key to making studying for standardized tests a much easier process for you. Because if you already had a strong foundation, it'll be essentially just reviewing it again.
Thank you, Lawrence. And I'm going to pipe in there and say, in our introductory biology course, that we have 7 habits of mind that we try to teach. Instead of kind of memorizing stuff, it's really to practice these habits of mind. And I had them along the sides of the slides, but we call it You ABC It, and it sounds dorky and juvenile. And people who come into Bio 230, I think Lawrence was one of them, was like, oh my God, you know. And by the end of it, you're like, oh, hey, these really work. And so U is for use evidence, A is for ask questions, B is for be skeptical, C is for cultivate wonder, I is for identify confusions, and T is for think like a biologist or scientist or whatever. But that ability to identify confusions or have wonder and just be curious, identify confusions and ask questions will take you so far if you follow through on those habits. And being skeptical, don't just like, well, they said this, but how do they know that? Are they sure? What are they, you know, just dig in there, and that's going to take you so far.
I agree. Sorry, go ahead, Kelechi, please.
Oh, no, sorry. No, I was just going to jump in and quickly, and I think Lawrence did offer just sort of like the, what he said is very correct, like at the very like latest, right? But also remember, because many students I think don't tend to recognize that the actual application process, let's say specifically for medical school, is honestly like a full year, right? So for those that want to start medical school fall 2021, the application opened June 1st of 2020. So keep that in mind, and applications occur on a rolling basis. So let's say I have taken my MCAT, let's say I took it in April of this year, and I hit submit on my application on June 15th, compared to someone who doesn't take the MCAT until, let's say, November, then their application is going to be completely delayed because they still have to process the application, and then you honestly, you won't know your score. So what you're up against then is kind of putting yourself at a disadvantage just by way of how the rolling admission cycle works, because people are getting interviews and people are getting admitted. So you may potentially have someone that, because they submitted their application far earlier in June, actually be getting an acceptance letter in October or November, which means that certain seats are already gone. And then if you wait until that time to just submit your application, it's going to be, you know, at a disadvantage. So I always recommend that students get their application in as early as possible and have taken your MCAT so that you can actually receive your score back before that original June date. Because if you don't really care for your score, then you can kind of determine what you want to do. So I think that the end game is just try to maximize your potential for having an application that's as strong as possible. And one of the ways to do that is to submit as early as possible. And you do that by completing all the requirements as soon as you can. So just a thought.
I also want to add a few things too. I'm noticing a few questions about whether or not folks should kind of do the MCAT just to kind of see and experience it and see what it's like. No, do not take the MCAT just to kind of get a sense of, oh, let me see how I'll do, all right? And that's true for any kind of the GREs or any of the preparatory cleans. Whatever score you get becomes a part of your permanent record. So even if you do retake the MCAT or whatever exam again and your score is significantly better, all of the professional schools are still going to see that original score. And even though they're going to take into account the highest score, they're still going to, there may be some unconscious bias, right, that shows that you didn't do too well the first time. So do not take the MCAT until you have done the appropriate, or any GRE, whatever entrance exam there is, until you have done the time and the energy and the investment in preparing for that adequately, because it will be becoming part of your record and the admissions committees will see that. Now, some people are asking, well, should I take a year off? Take the year off if it's going to give you the time. There is no rush, guys. In fact, some of the best applicants are those who've taken the time to really, really build their application, get some additional experience, and do some intensive preparation for that entrance exam. We know that many of these standard exams are biased. We know that they are faulted. We know that they have some challenges, and they are not the best examples, really, of people's potential intelligence. We know that, which is why a lot of medical schools and other graduate programs are getting rid of them. But the truth is that many programs still look at them. So I absolutely make sure all your prerequisites are done. Make sure you have a strong foundation. The best way to prepare for your MCAT is exactly what Lauren said. Do well in your classes. If you have that knowledge and that foundation, you then are trying to remediate in preparation for your MCAT. That's not the best way to learn the foundation of it, okay? And if you want to experience what these exams are, then do practice exams. There's plenty of them out there that give you a sense of what they're like. And there's a lot of free practice exams out there that are available on many of the websites that Laura and Brianna have listed for you.
Okay, so that's kind of starting to get to the end of the questions that neatly bundle with each other. So I'm gonna scroll through and see if we can find some that pop out at me here. And so Lawrence, maybe you could speak to kind of what kind of clubs that you were involved with in terms of pre-health or pre-med while you were at San Francisco State.
Yeah, so when I was at San Francisco State, I was involved with the Pre-Health Professions Student Alliance. I'm not sure if they've changed names since then, but this was a pre-health, specifically a pre-medical society organization, and that we're focused on getting as much volunteer experiences as possible and getting involved with, specifically with UCSF and Stanford in terms of volunteer opportunities. In terms of getting involved with pre-health programs, So I've been asked a lot of questions about like, should I be involved with pre-health organization? Should I start one? Should I do X, Y, and Z? And the answer is that there's really no straight road. There's really no straight path that everyone should be part of a pre-health program. My recommendation is find one, as just as Dr. Magana and Dr. and Kalishi has been mentioning time and time again, that the important part is find something that you're really passionate about and something that can really speak to you as a person. So if you feel that getting involved in a pre-health organization will allow you to get involved with the populations that you're really passionate about, then I would say go for it. If you feel that this pre-health organization will give you the resources, specifically the review, because a lot of pre-health organizations have partnerships with test review companies such as the Princeton Review or Kaplan, and you feel that that will give you a good resource to prepare for your standardized exams, I would say go for it. Best way is to just always be a good listener. Be there, always be present, because you never know what opportunities might pop up.
Thank you. And so as I go down the list, there's a couple of questions about what's the best major if you plan on going to veterinary school. And I would say that's just very similar to all of the other pre-health professions. There is no perfect major. You just have to make sure that you meet the requirements and you can major in whatever you're most passionate about. If I'm not qualified for veterinary school or do not meet the requirements, what's a secondary career? There are careers called vet techs, I think, and that they allow you to be the assistants to the veterinarian. And so that's a career you might want to think about. I'm just going to shoot through some of these that I can answer easily, and the panelists can pipe in if they see others. Let's see, I did say they're trying to remove, at least some universities are trying to move standardized testing, but it's not a thing yet, not everywhere. Let's see. Scrolling. And so I saw one student who said, you know, I'm kind of gotten a few C's so far. You know, what can I do going forward? What's the best advice for a student who's got some C's in the record and they want to know how to move forward?
Yeah, do not let C's be a barrier to your success. What schools want to see is they understand that there are many students who enter college either lacking the appropriate preparation depending upon what school you came from in high school or what was going on in your life at certain periods of time, because we know that many students are dealing with life issues and family issues that can impact your progress. The most important thing you want to do in terms of your academic career is you want to show trend upward. So if you started rough during your first 2 years, you want to end on that high note, which shows the schools that you have the abilities, that you kind of figured it out, and that you really do have that potential. What you don't want to do is have a record that's high and then all of a sudden it takes a precipitous drop at the end. You can explain that certainly in a statement, but it's going to require some additional work. If you find, again, guys, please, if there are any points where you find that you are struggling with classes, do not wait to ask for help. It is much more better to do prevention than try, you know, while you're expecting it, than trying to fix it after it's done. So do utilize whatever resources you can. Go to your professor's office hours. Work in study groups, seek out tutorial services or counseling services, particularly if you're dealing with some personal stuff. Take the time off if you need to focus on family and work, if that's an issue and if it's going to impact. One of the biggest mistakes I see students doing is just trying to sludge through school just to get it done, right? And then their grades pay the price, because in the end, that's not going to do you any good at all. So be clear of what your priorities are, and whenever you are struggling, make sure that you're accessing the resources to optimize your success.
Thank you. Here's one about, is it better to stay at a CSU school and get almost perfect grades or transfer to a UC and get average grades? And I would argue that the two schools aren't that different, but I'll let the panelists weigh in on that one.
Go for it, Kalechi. No, she's biting at the bit for that one.
He's laughing at me because I saw that question. I'm like, no. The short answer is do great wherever you are. I honestly want to like have a one-on-one session with that person and ask them like, well, what do you mean? Why would you even think that you would be average somewhere else? Like, let's have a deeper conversation because I feel like there's more there. I'm never going to recommend anyone to do anything where they're just going to be average. It doesn't, no, to me, it's just not acceptable. I think I understand the question, right? That there's this sort of, I want to just say honestly, misnomer, right? That there's a leveling of schools and the level of difficulty. And, I went to UC Berkeley for undergrad and then I did a little bit of a post-bac at State, so I can speak to this. There are definitely differences just in terms of like the classes and the coursework. And how the classes are presented and even things like the class size, right? Classes of 1,000 at Berkeley in pre-med versus the smaller coursework. Ultimately, I am going to recommend that you find the environment that is most supportive of you as a whole person. And so as a whole person, I think some people mention that, they're working, they're trying to do research, they have family obligations, and all of those things matter. And so I don't necessarily recommend you going to an institution just because it has this, this sort of reputation, but then you honestly are not finding yourself thriving there. The most important thing is to find an environment that you're going to thrive in, because when you thrive, that's what's going to shine through on your applications. So that's my response to that. I would say stay wherever you are going to thrive, and then your application will speak for itself.
Thank you. All right, here's one that I think any of the panelists might be able to address. If you had imposter syndrome, how did you get over it? The student's also coming from a first-generation background.
Well, I think imposter syndrome is real. It's very real. And yeah, I can definitely speak very personally to that. As I mentioned earlier, I came from a family of farmers, first in my family to go to college. And then once I got into UCSF, I was surrounded by these people from really, really prestigious backgrounds, very privileged and very knowledgeable. Like, don't get me wrong, they're amazing people. Okay, they're amazing people and they're wonderful physicians. A lot of them have graduated now. But it can definitely feel like you're out of place and that you think to yourself that they might have made a mistake in letting you in, or you getting into UCSF. And so what I could say is that it's never easy. And I feel like, unfortunately, because of our backgrounds, certain people would be more predisposed to experiencing imposter syndrome more than others. And my advice to that is it's okay to feel it. Perfectly normal. A lot of people feel it. Even these classmates, when I talk to them, this is a bit of a tangent, but I had a class where we would have these sessions wherein some students would ask questions demonstrating what they know about the subject. And everyone was asking a specific question. Everyone seemed to know, from my perspective, a lot about a topic that they're talking about. We're talking about the heart. Everyone seemed to know everything about the heart. And I thought, am I not studying enough? Do I not know everything? And then I talked to these people and it turns out, the only things that they mentioned were the only ones that they knew, or the only ones that they studied. Like if for any other question, they knew nothing about them as well. So the reality is that everyone experiences imposter syndrome. Some are more predisposed than others, but it's okay. The important part is that you focus on what works for you, in terms of like what works for your learning style, what helps you thrive, the people that support you and the people that help you grow. Focus on those. Whenever you're feeling that you're out of place or that you need to perform better or that you're just not fitting in, talk to people, talk to someone, talk to your professors, your friends, your family, talk to anyone who can listen and dispel the, honestly, like it's a warranted feeling, but it's coming from a place of, because you want to do better. So that's my take on it.
Okay. Tomas?
I think I think there can be a lot said on this particular topic. I think it's an important one to do some reflection on and some dive in. And clearly, I think every single one of us on the panel has experienced this, as Lawrence has said, to some level. Ultimately, I think what much of imposter syndrome is about is, for some reason or another, we all seem to have embraced this notion that what we perceive as deficits are actually true and real. And what it is an emphasis on this kind of deficit-laden mentality that I'm not good enough, I'm not good enough, I'm not good enough. When in fact, when you do some real deep reflection and you really kind of understand the journey that each one of us has lived as a human being, particularly those of us who are first gen or who come from whatever unique situation is that there is a mountain of assets and strengths which we have acquired that are going to make us ideally suited to serve others and to help others in a profession of health. In the decades that I have practiced medicine, I have never once had a patient ask me what my GPA was, where I went to medical school, or where I went to college. Not once have I been judged by those metrics, okay? And ultimately it comes on whether or not my patients feel safe and feel comfortable. What my patients care about is that I am a competent provider, that I am able to connect with them as a human being, and that I am able to understand in some ways the journeys that they are living and the emotions that they are experiencing. And what I pull from that to do that best is from my own lived experiences, from the lessons I have learned, from the struggles I have had, from the challenges I have had, and from the understanding that all of those make me uniquely who I am and why I'm uniquely suited to practice medicine. So what I want each and every one of you to do, right? This is part of your homework, and I know this wasn't an assignment, a necessary part of the thing, but I'm actually going to give you all an assignment.
Is it going to be graded?
Oh yeah, and yes, Laura's going to grade each and every one of them, so make sure you send it to her. No, there will be no grade to this, but I actually want you to create a list of every element of strength and power and asset that you think you own and yet are uniquely belong to you, whatever it may be or how minimal it may be. Because that will reframe for you what this notion of imposter is. Because nobody can take away your lived experiences. Nobody can take away the lessons that you have learned from surmounting challenge, whatever it may be. And all of those, if you can talk about those in your statement and talk about those in your narrative and in your interview with me and why they are so ideally suited to do the profession that you want to do, that's not imposter. That's you, okay? Now the academics and the academic preparation, we all understand that that's all part of your preparation. It's all part of privilege, the schools you went to, the life situations you're facing, right? Some of you are working 4 jobs, just trying to make ends meet. Of course, that's going to impact your academic success, all right? You have to own that and acknowledge that, and then talk about it if for some reason it does, affect your academic grades. But don't kind of believe into this notion that you're less than, because that's a long and kind of torturous hole to fall into. And so that's another lesson I learned. I wish I had learned at your age. So those are my thoughts on it, and I can go on a lot longer, but do your homework. I'm wanting each and every one of you to do that assessment and inventory.
So thank you for that, Tomas.
Can I quickly jump in? I know we are at that. I'm so sorry.
We'll let Kelechi in one last word, and then we're gonna.
I'm sorry, not sorry. Okay, no, because I laugh because so Tomas, we already know he's my mentor, he's my friend. His wife is also a mentor and friend, and we have these conversations about the fact that, like, yeah, I don't really deal with imposter syndrome. And I think when I honestly took a step back, and that's not to say that I've never had moments of just like, oh my gosh, this is hard, right? Or OMG, what am I doing? That's not what I'm saying. But I think I've always sort of at least really tried to approach life from this perspective of kind of utilizing my faith and what I really believe my purpose is in life, and feeling that anywhere that I am at any moment in time, it's because I'm meant to be there. And so often when I talk to students who, or anyone, when they talk about imposter syndrome, and when they share to me the thoughts that are going through your head, I'm like, well, who's ever come up to you and said anything? And I have yet to find a single person that can say that someone did. And so typically it's strange because it's really in our heads, right? Rarely is it because we've had people bombard us and attack us and say, you don't belong here, you're not smart enough. And I'm not saying that that never happens, because I do know that it has happened for some people. But a lot of times it's us fighting ourselves within our own minds about what we think someone is going to think about us. And so I think if we just take on this activity or this process of just like renewing our mind and the way that we think and approach ourselves, and this idea of belonging in who we are and who we are meant to be, that will really, really help us in that internal fight that happens. Because for every single last one of you, there's 103 people left. You are right where you are meant to be. There's not a professor, a student, a peer, a researcher that can tell you that you don't belong here. You're right where you're supposed to be. So if you really, really earnestly believe that and you walk in that, even when the thoughts come, you'll be able to kind of like snipe those thoughts out. So I take myself to be a sniper of toxic thoughts. You have to snipe them when they come. You have to snipe them, because if you don't, they will take seed and they will grow. So just keep sniping and keep moving and keep connecting with mentors and people who are going to help you do that along the way.
So thank you, Kelechi. And so I just want to thank all of the students for coming today. I think this really is a great first step towards launching your career in some sort of health career. And I want to truly thank all of the panelists as well. So I want to start with Brianna, who put together this panel for you. And I hope that you found the panel really useful. And Lawrence, Kelechi, Tomas, and Armand, who had to jump off for a little bit, like many healthcare professionals, I'm sure he got called away for something totally important, but we appreciate you being here and know that you'll be back teaching Sci 239 and maybe help out in panels in the future. But just, I know how busy you all are, and thanks for your time, your wisdom, your insights, and your goodwill. It's much appreciated. So I hope that everybody will give, in either the chat or Q&A, give the panelists a little love, but we'll keep doing the good work. And we will also post, the slides are going to be on the biology website, and the recording of this session will also be on the biology website, probably on the homepage or maybe just one click away. But if you want to look for them, that's the place to look.
Laura, can I add, I realize that there's a lot of questions, very specific questions that students have asked, right, with regard to PA schools and nursing programs and all of that. And I realize that those are really important questions and that need answers. And, Kelechi and I have, and I'm saying this publicly for the students to know that Kelechi and I, have talked with you about hosting a series of career-specific panels from PA programs to nursing programs, probably related to medicine, that we would like students to be invited to, so they can ask very specific questions about those particular schools.
Yes.
So I don't think this is going to be the end, right? By any means, this is just an orientation and an introduction. And I realize students have a lot of very specific questions that we will all be available to answer over the course of the year.
Yes, we hope to keep these going. They might be more specific, as Tomas or Dr. Magana said, but this is kind of a new format for us, given that we're all operating remotely. But I think it's a great way to give you access to people in the field that can answer your questions.
Good luck, everybody. Have a great year.
Very good. Yeah. And take care and stay safe.
Take care of yourselves, please.
Yeah.
Yes.
Take care.
And feel free to reach out. I think Laura will provide information. So we're here.
Yes, and yes, please feel free to contact us by email.
Okay. If all the panelists want to provide email addresses, I'll put them in the PowerPoint so that people have them.
Yes.
But I'll leave that as an option so you don't get deluged.
Should we put it on the chat box?
Certainly.
Okay.
If you're game for it, throw those emails in the chat box.
Yeah, I also told the students that I have you know, in the anatomy. I think a couple of them were on this. I think I recognize Mateo was on here too. You know, as the semester goes, and then as we start the following semester with the healthcare field, and I'll be able to provide and bring some of the healthcare professionals just to discuss about the specific fields that we have too. So it's a great beginning. I think this is a good way to start out things. And sorry, I had to jump off. I had to go see a patient.
Yeah, we figured you were busy doing important things. So we missed you though.
And there'll also be a class, community research with communities in the fall, in the
Nice.
spring as well. So we'll share that.
Okay, very good. Terrific.
All right, we'll be in touch definitely
Okay.
and available. Okay.
All right. Well, thanks so
Thank you
much,
very much.
everybody.
Very nice.
Totally appreciated. And yeah, I think the emails are all in the chat now. And
I'm definitely open. I'm not going to put my email out there only because I receive so many that I hate to make promises that I'm going to get back to them within a period of time. And right now, I'm sorry, we're dealing with the COVID.
yeah.
So I think the best way to reach me, oh, good Lord. Kalechi, can I offer that?
I knew it was coming.
I'm sorry. I have to be honest, guys. I just right now, I'm afraid that if you send me emails right now, it's going to sit there for a long time. And I hate doing that to students.
Yeah.
So
I will apologize in advance too, but please put pre-health SFSU orientation in the subject line in all caps, and that will at least help draw my attention to it. Because
That's a good idea.
Perfect.
there you
Okay.
go. Okay.
Very good.
All right.
All right.
Bye-bye, guys.
Bye-bye. Okay. I'm going to end the meeting and I'll see you all later.
Hello.